Welcome all to our first webinar on the overview of the Active Neighbourhoods for Older Australians project for funded houses. Welcome. First up, I'll do a bit of housekeeping, then I'll introduce myself. I know some of you may be watching our webinar for the first time, so if you have any problems during the webinar, please phone the number at the bottom of your screen. As a backup, everyone will receive a recording of this webinar next week, as well as it will be available on our website. If you have any problems, can't be resolved today, you'll be able to view the recording. Please also share this webinar with any other staff, volunteers or committee that might be involved in this project. If you are listening via the phone, you will notice a small time delay between the audio and the screen. This is normal, so don't be worried. Our presenters will answer your questions at the end of this presentation, but you can also type in your questions as the time goes by. At the Ask a Question button is a dark blue icon at the top right-hand corner of your screen. Don't leave your questions to the last minute. We will aim to finish no later than midday Eastern Standard Time. I would also be full if all participants could provide feedback on today's webinar. To submit feedback, hit the yellow icon on the top of the right-hand corner of your screen at the end of our presentation. I'll just start by introducing myself. Some of you may know me. I'm Emma Cross, and I have been in the neighbourhood house sector for over 20 years. I was a neighbourhood house coordinator in Victoria, and then I've also worked for local government for the last 12 years, overseeing the funding for neighbourhood houses. So I'm very passionate about neighbourhood houses, and it's an interest of mine. So I have taken leave from the department to run this Australia-wide project. So welcome. Also in our team, we have Beck Benini. Some of you may have spoken to her on the phone. She'll be part of future webinars, so it'll be great for you to meet her. Also today presenting will be Ben. Ben works in the School of Public Health at the University of Sydney. A major focus of his work since the 1990s has been the development and evaluation of physical activity strategies. Working closely with government and non-government agencies. Over the past 4 years, he has been the project advisor for the Victorian Active Ageing Partnerships. He is a member of the coordinating team of the Active Neighbourhoods for Older People initiative. Now I start the slide presentation. Bit of a background about Musculoskeletal Australia. Musculoskeletal Australia has supported people with arthritis and musculoskeletal conditions for over 50 years. MSK is a place where those living with musculoskeletal conditions can get involved and get supported. You can find more information at our website, www.msk.org.au/. We also have a helpline which have trained nurses and volunteers that you can ring up, and they'll provide you with information and resources. That is weekdays 9 to 5, and the number is 1800 263 265. The Active Neighbourhoods for Older Australians project. The Active Neighbourhoods for Older Australians project will aim to enhance understanding of the benefits of physical activity, improve access to physical activity amongst older people through the neighbourhood houses, and enable physical activity to be a regular component of participants' life, and support the engagement of physical activity by developing a peer support program and improve the knowledge and skills of staff and volunteers. From research, we know that 27.2% of people provide a structured physical activity program for older people in Victoria. Neighbourhood houses are the greatest percentage of people accessing those programs. The project has a number of components. The first component is our project management, which we have 2 full-time staff employed to assist you throughout this project. You can contact us at any time and we'll assist you where we can. We'll also be delivering age-appropriate physical activities at neighbourhood houses. We have funded neighbourhood houses across Australia with this. With development of partnerships and collaboration. We will do a survey at the commencement of the project around partnerships, and then we'll provide you resources around the gaps in partnerships. Capacity building of staff and volunteers, neighbourhood house and local organisations. We'll be running 6 webinars throughout this project, this being one of them. And awareness raising, we'll be developing materials around awareness raising of the benefits of physical activity for people over 65 years of age. We'll also be running some focus groups around this material to see what works best and what sort of media would be best to roll this out, as well as we'll be asking you to promote these resources locally. The Community Connectors program will design and deliver a Community Connectors online training program, which Ben will go into a bit more later. We'll also do pre and post surveys with the Community Connectors. And the project valuation and research, Ben will explain this later in his presentation. Supporting older people engaging in physical activities in neighbourhood houses. Neighbourhood houses for older Australians recently funded 64 neighbourhood houses across Australia. With this, they'll be providing 95 new programs across Australia. Approximately 5,602 new participants will participate in these programs, and approximately 1,959 existing participants will also participate in these programs. MSK will be funding another 30 houses across Australia to commence in 2020, which will mean even more physical activity programs, which is wonderful. Part of the project, we'll be providing you with some marketing and social media tools. These will all be available on our website. We will have a branding kit, which will provide you with our logos and the way they need to be used. So both the Active Neighbourhoods logo and Sports Australia logo should appear on any relevant communications and materials advertising the program which we have funded. Social media, we also have a Facebook and an Instagram page, which will be our way of connecting with you on a daily basis, ongoing basis. That's Facebook and Instagram. We also ask that in any photos of programs you are running, that you tag us. It's Active Older People, both Facebook and Instagram, and you use the hashtag MoveItAusGrants and Active Neighbourhoods. For more information and to access these documents and logos, please visit the Active Neighbourhoods website. The contact details for the Active Neighbourhoods team is, as I said, the website, our email address is anoa@msk.org.au, and there are our emails. So mine is emma@msk.org.au and Beck's is beck@msk.org.au. But if you email the ANOA email address, we'll both access those. Now for questions. Okay. Is anyone having trouble with buffing and cutting out? I'm sorry about that. So anyone got any questions, could they please ask them through the questions button? The only ones I've got at the moment are that people are having trouble with buffering and cutting in and out. Anyone else got any questions? Otherwise, we'll go on to Ben's and you can ask the questions at the end. Okay, Ben, would you like to start your presentation?
Thank you, Emma. Good to have the opportunity to speak with you this morning, and thank you very much for your interest in being part of the Active Neighbourhoods for Older Australians project. I mentioned I am an advisor to the project, which is continuing on my work with Musculoskeletal Australia, where I've been supporting the Victorian Active Ageing Partnership for a number of years. And as Emma mentioned, in the background data collection, scoping work that we did within the Active Ageing Partnership in Victoria, we found that neighbourhood houses were the major provider of physical activity programs for older people. Probably not surprising to you, but I have to say a little bit surprising to us that you're providing more programs even than councils and community health services, University of the Third Age and others. So that highlighted to us the enormous potential that there is to be working with neighbourhood houses in increasing the reach and inclusiveness of physical activity programs for older people. And in my role in the project, what I'm supporting is the collection of information that is going to enable us to learn about the best ways of engaging older people and sustaining their involvement. So what I want to do this morning is fairly quickly, and there'll be opportunity for questions at the end as well via the question manager, to talk to you about the reasons why we're undertaking some data collection in different ways, and talk about the methods that we're going to be using to do that. I hope you won't find this too scary or daunting. I'm going to present to you all the things that we're hoping to do, but really it boils down to quite a few simple things that we've thought about carefully and we consider should be manageable at the house level. And then there are a couple of additional things that I want to talk to you about, which are opportunities that will contribute to some learning that will assist neighbourhood houses in the future in the way that they work with older people. So the purposes, as you can see on the slide there, of undertaking evaluation are to gain insights into the ways that we can reach and engage older people in physical activity at neighbourhood houses. And secondly, we have a requirement as part of receiving the funding through the Better Ageing program from Sport Australia to provide back to Sport Australia information about participation impacts, and particularly the numbers of new people, their characteristics, and the ways that they've been affected and benefited from their involvement in the project. And I would like to, before I move along, to talk about the things that we're wanting to collect information about and the ways that we do it, to recognise the reason that we're doing this. And I've had the privilege of visiting neighbourhood houses and other areas where physical activity programs are provided to older people. And that's deepened my understanding about the very important contribution that these programs can make to people in their day-to-day lives. I mean, we know that physical activity is good for people's health and reduce risks of chronic disease. We know that it helps people to function physically and to be able to be active in their families and in their communities. And we know that it helps to lift people's mood. But there are other ways that participating in group-based physical activity makes an enormous difference to people. So what I've put up on the slide there before you is a couple of quotes that I think tell some people's stories about what it means for them to be connected to local physical activity programs. So the first one is from a gentleman who says, basically my wife died about 10 months ago and I belonged to the arts crafts, but I didn't have anybody else to speak to. So I used to, only Thursday mornings I'd have anyone to speak to. So I had to go the whole week before I spoke to somebody again. And so therefore I've joined this group because at least I have someone to talk to and someone to make friends with. I imagine you've seen a number of people like that through your work in neighbourhood houses. Somebody else says, a woman participating in a multicultural physical activity group, we feel the stress is released and it helps our mental health, and we don't feel as stressed and we feel happier, especially with people living alone. I live alone and I feel when I go out, I feel much better and all of my life changes. So these programs that you're involved in delivering have important health benefits, and they are very significant things in people's lives in terms of building friendship, lifting people's mood and improving their sense of happiness and their overall quality of life. And so I'm including that because our rationale for wanting to go about collecting information about how programs are delivered and what effects they're having for participants is to pay respect to these kinds of contributions and to enable neighbourhood houses to see the ways that their participants are benefiting from the programs that they're offering. So I want to highlight some guiding principles that underpin the way that we're supporting data collection in the program. First and foremostly, you'll see there it's about learning. It's about learning how we do things and how we can do things well in the future. It's not about holding up individual neighbourhood houses to scrutiny and asking you to tell us the extent to which you've performed against certain metrics. It's about finding out how you did it and what you learnt from your experience and how others can benefit from that learning in the future. We're really interested in finding out, and this is the second point, the different kinds of approaches that neighbourhood houses are using. And the great thing about this project is that we've got neighbourhood houses from all over the country, and they're working with different community groups, and they'll be using different kinds of approaches to connect with different people in their community. We'd like to find out about the methods that are used and what works well and what needs to be changed in the future. We'd also like to find out about how you've progressed in the plan that you've proposed to implement during the Active Neighbourhoods project. So in your proposal that you put forward for funding, you outlined some strategies that you were proposing to implement, and we want to find out about how you've gone with implementing those and what's worked well and what might need to be changed or adapted for the future. The third point here is that we're interested in the collective contribution of neighbourhood houses. So the thing I want to highlight here is we're not going to be writing individual reports or scrutinising the activity of a particular neighbourhood house. We're interested in the overall learning that we can gain from the efforts of neighbourhood houses collectively in states and at a national level. So the point I want you to appreciate is we're not going to be reporting on you individually in our overall collection and summation of the data that we get. There is an element of this which is going to entail inviting participants to complete some surveys, and that process has undergone ethical approval, so there are elements in that where participants are required to read an information sheet and to indicate their consent before they go ahead and complete the survey. So it's important for you to understand that that is a part of the way that we go about collecting information from participants to ensure that it's done in a way that's respectful of their privacy and their rights as individuals. The next point, the very important one, is that we're here to offer support. If you have any questions about any of this, any of the things that I'm talking about today, or any things that you read in the emails that we send forward to you and the information we provide on the web, do not hesitate to ask questions. That's what we're here for. So please reach out. Emma has given you her and Beck's email addresses, so they would be your first point of contact if you've got any questions. And lastly, all of the learning that is undertaken through this exercise of collecting data from neighbourhood houses is going to be fed back to you. So we want you all to benefit from the insights that we're getting through this exercise. All right, I'm going to move on now to talk about the primary elements of evaluation and learning. We'll talk about process evaluation elements and the methods that we're using to undertake process evaluation, and then secondly, impact evaluation and the elements we're looking at and the methods that we're using to undertake that impact evaluation. So when we talk about process evaluation, we're talking about collecting information about what you do. It's about how you've gone about trying to raise awareness about your program, to connect with older people, the ways that you've maybe adapted your physical activity programs to make them more attractive, to make them more beneficial. Process is about the implementation of your strategies. And the range of things that we're interested in collecting information about particularly are listed here on this slide, and these include the organisations and community groups that you've formed linkages with and you developed some kind of partnership with. It might be a networking, information sharing kind of a partnership, or it might be a deeper, stronger collaborative relationship. We're interested to find out about the organisations you link to. We're interested to find out about the ways that you've gone about raising awareness about your offerings, things that you have put in place to educate older people about physical activity, how to undertake it safely in a beneficial way, to raise people's awareness about the different way that physical activity can contribute to their well-being. Next, we're interested to find out about any additional outreach activities that you've undertaken. And one of the elements that we're promoting within the Active Neighbourhood project is a community connector model. And what that entails is finding some volunteers, probably older people who are well and active themselves, who are interested in undertaking some kind of training so that then they can become buddies, peer support people, new people that could join the centre. And so we'll tell you more about that at a later time, but it's an interesting approach that's come from the United Kingdom, and it's looking to be very promising because it particularly expands the reach of your awareness-raising activities, and it helps new participants, particularly during that early stage when they might be a little bit uncertain and they benefit from having a buddy, somebody that can help them to be integrated into a program. The next thing that we're interested in collecting information is a very simple thing. That's really the types of physical activity program you're offering, whether they're gentle exercise, whether they're possibly strength and resistance, whether they're water-based or walking soccer, walking basketball, dancing. We're interested to know the range of types of physical activity programs that you're offering. And lastly, the ways that you might be modifying those activities and the way that you deliver them, possibly the mix of things that you do at particular sessions. You might be introducing more of a social component or possibly an educational component. Very interested in knowing the things that you do to modify your programs to make them more interesting and engaging for all the people. So that's the range of things that we're referring to as process evaluation, which, as I've said, is about understanding the way that you go about delivering your programs and what you're doing. How are we collecting this information? Well, this table here summarises the things that we'll be undertaking in our contact with you to collect the information. And as I said at the beginning, it boils down to really a few pretty simple things. So you'll see across the top of the table here, 3 main ways of collecting information from you: SurveyMonkey, progress reports, and end of project interviews. And you'll see then on the left-hand side, those things that I just listed on the previous slide of the different aspects of your delivery that we're interested in collecting information about. So let me just summarise it briefly for you here. As I said, we're very interested in the way that neighbourhood houses connect with other organisations and groups, who you're connecting with, and how that might change over time. So the way that we're collecting that information is primarily through a very short, user-friendly SurveyMonkey. Shouldn't take you much more than 5 minutes or more. If you've got a lot of partnerships, it might take you more than 5 minutes, that we're going to be sending out to you quite soon. And you'll just need to click on the link that's included in the email and put your information in. So we'll be sending that to you soon, and we'll be repeating that towards the end of next year to find out about whether you've continued to work with the same organisations or whether the way that you've worked with new organisations has developed and changed and how that's contributed to your programs. So that's in relation to partnerships. Now, the next way that we're collecting information is a pretty normal kind of process for organisations that receive external funding, and that's where we're required to complete a progress report. We're going to be asking you to complete 3 progress reports over the course of this project to the end of next year. The first one, which we're going to ask you to complete before the end of this year, I should think late November, early December, will be a shortened version because we recognise that you're really getting it going. So the 2019 end of year progress report is only going to be asking you to report about things that you're doing in relation to raising awareness, education, and program types and outreach. So it shouldn't take you too long. We've given careful thought to how that's structured. Emma, as she's introduced herself, has explained she's got a lot of experience working in neighbourhood houses, and we've benefited from that in the way that we've structured that progress report. Then there'll be 2 more progress reports that will be required in the middle of next year, so that's at the end of term 2 next year, and at the end of next year, that's at the end of term 4. And that will have some additional elements to find a little bit more about partnerships and program modifications in addition to those other things that are listed. And the final method that we're using to undertake process evaluation is one where we will contact you, not all of you, a number of you by telephone to have a chat with you about the things that you've learnt from your involvement in this project, essentially, what you found went well, what were successful strategies for engaging older people, what were some things that you learnt that you would consider doing differently. We will look at the progress reports that have come in, and we'll get a sense of the different kinds of strategies that are being used, and we'll invite a range of neighbourhood houses from across the country who are using different kinds of approaches. So we'll be very selective and purposive in approaching neighbourhood houses. And of the 90 or so that will be funded by the end of next year, I imagine we might contact 30. Of course, it'll be completely voluntary. We hope that if we contact you, you'll be willing to take part in that telephone interview. So 3 main elements of process evaluation: SurveyMonkey soon and at the end of 2020, progress reports, a short one by the end of 2019, 2 more during 2020, and then the interviews, which will be undertaken with a subgroup of the neighbourhood houses towards the end of next year. All right, I'll move on now to impact evaluation and what we're looking to collect information about in this arena. And you'll see here that the things that we're interested here are the numbers of new participants that you are engaging with in your programs and their characteristics, with their cultural backgrounds, whether they're Indigenous or not, their gender, and so forth. And also, we're wanting to undertake an effort to collect information from new participants about the way that they benefit from their involvement in the project, and we're going to be doing that through a participant survey. I'll talk a little bit about that in a moment. Then there are 2 other elements of this impact evaluation, which are voluntary from your point of view. We hope that you'll be interested in contributing to this, but I've listed it here because I want to let you know about it, and I'll be in touch with you in the coming weeks to find out if you're willing to support this. And these are concentrating on how frequently your new participants are taking part in your physical activity programs, and what are some of the things that are contributing to more participation, more adherence. And then lastly, the outcomes that your volunteers, your community connectors, are experiencing from taking on that role in the program. So those are the 4 elements of impact evaluation. The top 2 are what we're asking all neighbourhood houses to take part in, and the lower 2 are those that are optional. So again, to look at the methods that are involved in doing this, again, it boils down to a few simple things. Across the top, you'll see there's a progress report that you're already completing. There's some hard copy surveys, participant surveys, and then there's the optional elements of attendance records and another SurveyMonkey for volunteers. So the progress reports are where we'll be asking you to report on the numbers of your new participants and your existing participants. The participant outcomes in terms of the benefits that participants get are going to be investigated by means of hard copy surveys, which I'll tell you about in a moment. And then participation frequency will be investigated by you keeping your attendance records and keeping a record of how frequently people are taking part in your programs. And the volunteer outcomes for your community connectors will be investigated through a SurveyMonkey that we'll ask those volunteers to complete towards the beginning of next year and at the end of next year. So again, it boils down to a few simple things, a couple of which are optional for you. All right, so the participant outcome survey. You've received these surveys, and you've also received the information sheet that has been developed by the team who are undertaking the evaluation of the overall Better Ageing program. That information sheet, you've probably noticed, is reasonably lengthy, and we've communicated that back to Sport Australia. We think that some people would find that a bit overwhelming, and so what we've proposed is a much shorter version, and we're waiting to get approval on that. Hopefully we will, and if and when that takes place, we'll let you know, and all going well, we'll be introducing a new participation information sheet process and consent process for next year. But as it stands at the moment, we're using what's been provided to us by Sport Australia. So a few important things about this participant information or outcomes survey. It's only for new participants. So these are people that have just joined your neighbourhood house physical activity programs for the first time. They might have been involved in other programs at your neighbourhood house, arts and crafts or adult education, and they're now switching over to a physical activity program. That would make them suitable people to survey. There'll be a number of people that have had no contact at all with your neighbourhood house in recent times. They would be people to invite to complete the outcomes survey. So it's only for new participants into your physical activity programs. As I said, they might be coming from other programs at the neighbourhood house into your physical activity program, and those people would also be appropriate to invite. This is an open invitation to new participants. We're very committed to not putting any kind of expectation or burden on any new participant. We don't want people to feel uncomfortable. We don't want them to feel that they're getting into something that they maybe didn't anticipate. And so the way that we're asking you to do this is when you're enrolling these new participants is to let them know that you are supporting an evaluation which is about finding out how participation in programs benefits people. And if the person is interested in supporting that, then you give them the information sheet, they read it, and then they indicate to you whether they want to complete the survey, and then you give them the hard copy survey and they complete it. In a moment, I'll show you the timing that we're proposing that will be followed for this part of the evaluation. So the important thing is it's an invitation that's sensitively delivered. It's not a requirement. There's no expectation on you as neighbourhood houses to get a certain number of participants. Really, the expectation on you is to manage this sensitively, to let people, the new participants, know that there's an opportunity to contribute to this, and if they're interested, to read the information sheet, and if they're happy with it all, to complete the survey. And as I said, we're working hard to get a shorter, more user-friendly information sheet that will hopefully be more manageable for the houses and for participants. The third thing about the outcome survey is that it would need to be completed by the second group session that a person attends. Hopefully, for those who are interested, they'll have the opportunity to read the information sheet, complete the survey at the first session. If for whatever reason they haven't made up their mind or there's not enough time, then they're welcome to take the information sheet away and to let you know when they come back to the second session if they're happy to take part and then to complete the survey. Please don't convey any expectation or even kind of make too much of an effort to pester or prompt people. It's really up to them. We want to respect their choice whether or not they want to take part in this, and we don't want to put any pressure on them at all. So if a person who's taken an information sheet is not able to complete the baseline survey by the second group session, by the end of the second group session, that's it. We won't ask them anymore to consider taking part in the evaluation. That's the window of time that they've got to complete the baseline survey. So those new participants who take part in the baseline survey will be invited to complete a follow-up survey, which will be a bit shorter, at the end of each of the 6 months that they're involved in your program. So that's at the end of 2 terms of program involvement. So what we propose you do is on your participant list for a program, you just put an asterisk next to the name of somebody who's completed a survey, or it's often the case, Emma tells me, that neighbourhood houses have a registration sheet for each participant. So what you can do is you can attach the completed survey to the baseline survey to the registration sheet, and that can provide you also with a prompt to invite that person who completed the baseline survey to complete the follow-up survey after 6 months. So I'll show you the timing of this in just a minute. but we're looking at baseline surveys being collected in the first couple of weeks of their involvement, follow-up after each 6 months of their participation. So it's possible that people that are newly involved in your program this semester or this term and in the first term of next year may end up completing 2 follow-up surveys at 6 months and at 12 months. It's important after the surveys have been completed and possibly attached to the participant's registration sheet that you store those in a secure environment. I imagine that's a normal practice in neighbourhood houses, but it doesn't have a lot of personal information. It will have the person's name and date of birth. It's an important ethical requirement that any survey that's completed is stored on-site at neighbourhood houses in a secure location, a locked site, possibly a drawer in a desk or a filing cabinet. And then what we're going to provide you is with some pre-addressed registered post envelopes. And at the end of each second term, well, in the case of 2019, it'll be at the end of this term, and then next year it'll be at the end of each second term. We'll ask you to send back the completed surveys that you've collected. If you've got any, you may not have any, which is okay, but those that you've got, you'll send them back to us, and then we'll enter them into the database. So, almost finished now. Thank you for your patience. The next slide here shows the way that this would work for you in terms of a flow of information collection. You'll see across the top of the table that we've got the terms of program delivery, term 4, 2019, and then term 1, 2, 3, and 4 for 2020. And you see underneath that there's start of the term, and then next year we've got start and end of each of the terms. And then we can think about the new participants that you will be recruiting in 4 groups. There'll be those that you recruit during this term. There'll be those that you recruit during first term of next year. There'll be those you recruit during second term of next year, and there'll be those that you recruit with group 4 during the third term of next year. And you'll see in the table there, the ticks show the times that we would want to be collecting the surveys from those different groups. So for the people that are recruited in this term, term 4 of 2019, we'd have the baseline survey completed, and then those people would be invited to complete the follow-up survey at the end of term 1 in 2020 and at the end of term 3 in 2020. That's where the ticks are shown in the table. And just, I might say, if you're feeling a bit overwhelmed with information at this point, you'll have a copy of all of this information with some accompanying written explanation and an opportunity to also contact us with any questions. For those in group 2, those who are recruited for the first time in term 1 of next year, they would complete the baseline survey at the beginning of term 1, then they would complete the follow-up survey at the end of term 2, 2020, and at the end of term 4, 2020. Those in group 3, who are the people who are recruited for the first time in term 2 of next year, they'll only complete the survey twice because we won't have any time beyond end of 2020. That will be a baseline survey at the beginning of term 2 in 2020 and a follow-up survey at the end of term 3, 2020. And lastly, those in group 4 who first participate at the beginning of term 3 of next year, they will then be invited to complete the follow-up survey at the end of term 4. So that's the process and timing that we're proposing will help us to collect baseline and follow-up information from from everybody at least after 6 months, and for some people who are recruited this term and the first term of next year, potentially for over 12 months. So as we said, you will put a note, an asterisk next to the person's name on the attendance record as a prompt to you to invite that person to complete the follow-up survey. When you've collected surveys after 2 terms, both baseline and follow-up surveys, we'll ask you to put them into the pre-addressed registered post envelopes and send them back to Musculoskeletal Australia. We anticipate you'll have some more questions about this, and we'll be available to answer those. All right, lastly, but not least, as I said, there are a couple of extra things that we're including within the Active Neighbourhood for Older Australians project, which are looking at opportunities for learning that can support the delivery of physical activity programs in neighbourhood houses and other venues into the future. We're particularly interested in learning about whether recruiting volunteers and training them as peer educators and community connectors is beneficial in terms of recruiting new people and supporting their involvement. And then secondly, we're also interested in exploring what are the things that help new participants to stay involved. So we've got these 2 additional projects that are both going to be carried out in 2020. I'm going to letting you know about them now for you to consider. We'd be absolutely delighted if you're interested in taking part, because we think that they're going to generate some useful learning that can feed back into neighbourhood house programs, and also be a demonstration of the way that the kinds of things that you do are contributing to health and wellbeing in the community. So Project 1 has an additional component of, for those neighbourhood houses recruiting community connectors or volunteers, asking those community connectors before they undertake the online training to complete a short survey, and then to repeat that survey at the end of 2020. That'll be a survey monkey. It won't be too onerous. And also for those neighbourhood houses that are involved in using community connectors to take part in telephone interviews that we will conduct with you, find out how it's gone, and also we'll do some interviews with volunteers and with older participants who've been recruited through community connectors initiatives, find out what that was like, what helped them, what might be adapted in the future. So we won't ask all of the neighbourhood houses that are involved in community connectors initiatives to undertake telephone interviews. A bit like the process evaluation, we will be selective in those that we approach in this. And lastly, the second project is probably even a little bit simpler. It really just involves you collecting, keeping your attendance records of your groups over the course of 2020. And then what we're going to do is look at those attendance records and to contact older people who are high and low attenders to find out what are some of the things that are influencing their level of attendance, and also we'll be undertaking some interviews with neighbourhood houses to find out what their observations are about things which are helpful for promoting a high level of attendance. So both of these elements of what we might call the enhanced evaluation are going to be conducted in 2020, and we'll send out an invitation for you later in this year to consider and to hear whether you want to take part. So thank you very much for your patience and your attention. I wanted to walk through all of that with you, and there's an opportunity now for you to ask any questions, and of course, if you've got questions afterwards, to send them to Emma or Beck. But if you've got questions now, please click on the question manager button and type them, and we'll take a few minutes to answer those.
Thank you so much, Ben. I appreciate all that information. I know that some of you may be feeling a bit overwhelmed that was a lot of information, but be assured that myself and Beck, every new thing that comes out, we will email you directly, as well as everything will be on our website, those sort of things. So please don't feel overwhelmed. One of the question is, where do we access the participation survey from? We posted them out to all the houses last week, so you all should have received them in the mail. If you haven't, please send us an email and we're sure you get them. So we've sent out enough copies of what you told us in your program report on how many participants you'd have. We'll send you a copy for each of those participants, as well as a information sheet, which is their consent to doing the survey, as well as we sent you a brief explanation about the project, so that maybe some volunteers or staff can assist people in explaining what the participant survey is about and maybe help them complete it. So yeah, you can also download the participant survey from our website if you need further copies as well, or you could contact us and we'll send you out some more copies. So these need to be completed within the first sort of 2 classes. If people don't complete up to 2 classes, then just sort of leave it. And once you've compiled all the surveys, could you please put them in the envelope we've provided you and return. If you need any more envelopes to return to us, please let us know as well. So hopefully that's answered that question. One of the questions, this is probably more for you, Ben, is physical activity. So the centre's ran physical activity in the past, hasn't ran anything recently or regularly. Is this classified as a new class?
Yes, it is. If you're offering something afresh, particularly when you might be doing it a bit differently to make it more inclusive of new participants, then we would consider that to be a new class. That's a good question. Thank you.
We're also going to try to do as many tools as we can to make this process as easy as possible. We'll also going to produce an Excel spreadsheet for those who won't be marking off on their attendance list. They can enter the person's name and when they completed the the baseline survey, and then when they're due to do the post follow-up survey, so you can highlight who's completed and not, so that you can get them to complete the other one. As well as we were compiling some frequently asked questions from today's webinar, as well as any questions we get along the project. So they'll be available on the website. So if you have a question, you might be able to find it on there as a solution. So, okay, so that, yeah, I think anyone else got any more questions? If you have any questions after we finish this webinar, you know, please email it to anoa@msk.org.au and we will answer those questions. So, so if there is no more questions, I really thank Ben for assisting today with the webinar, as well as everybody that tuned in to the webinar. Also, just to remind you that the webinar will be available on our website as of next week, as well as we'll email it directly to you. You know, please share this with anybody else in your organisation that might find it beneficial, especially the committee that may be wondering what your time's been spent on and what the funding is for. You know, they can watch in their own time from home or, you know, in the office. So if you have any questions or need anything, please don't hesitate to contact myself or Beck. So thank you very much and appreciate it.